I'm not Melanie Thompson. I want to be very clear about that, and I'm representing her. I'm happy to be doing so. Second, I realize that I'm the only person between you and wine, so that's a problem. But I'm going to tell you a little bit. Hopefully we can make this video play, and I'll start with that.
Tonight, we continue our series, The End of AIDS. Yesterday, we looked at San Francisco and at one of the nation's most ambitious plans to curtail AIDS. Tonight, we turn to a city where the struggle is much more difficult. Atlanta, Georgia, and much of the Southeast is by some measures the epicenter of America's AIDS crisis. And as correspondent William Brangham and producer Jason Kane report, the barriers to stemming the epidemic there are enormous. This report was supported by the Pulitzer Center on Crisis Reporting.
The alarm bells rarely stop in the inpatient and isolation wards at Grady Memorial Hospital. Here in Atlanta, just down the street from the CDC, in 2016, in the age of life-saving antiretroviral drugs, hundreds of people are still dying every year from AIDS.
The epidemic of HIV in America is forgotten, but not gone. People have forgotten that it exists. I think I have a better chance of winning the lottery than I have of ending AIDS in where we are today, right?
The southeastern U.S. is the epicenter of America's epidemic. These states make up 44% of people living with HIV, and they make up half of all new HIV diagnoses.
It's almost like the South is a different country. It really is about poverty, social determinants of health, racism. It's really a bunch of different things. It's
Carlos Del Rio.
So I just want to emphasize that this is all about social determinants of health. And if, as somebody has said previously, we don't address those, as Susan said, if we don't think about poverty and homelessness and all those other issues, we're not going to end this epidemic. So Fulton County, Atlanta's a complicated place. Atlanta's a city, but the city has absolutely no control over health. The city is primarily, there are two major counties, Fulton and DeKalb, but in fact, metropolitan Atlanta, if you look at the CDC reports, is comprised of 5 counties. And in fact, the city is more like 20 counties. Georgia has one of the highest number of counties of any state. And this is all very fragmented. So, but Fulton County is one of the biggest counties where a lot of the HIV epidemic is. And it was really back in 2014 when data was presented at a World AIDS Day event, and the Fulton County, chairman of the Fulton County Commission was there, and he listened to the data, and he was alarmed. And he said, we got to do something about it. So I think the first lesson out of this is that data sometimes actually ignites politicians to do something, and you have to continue presenting the data. You think everybody knows the data, but the reality is you have to do it over and over. He created a task force to address Fulton County in the city and put together a task force. And among the task force members, they elected 2 co-chairs, Wendy Armstrong, who's a physician, who is the director of the biggest HIV clinic in Atlanta, who's also the chair-elect of HIV-MA, and Daniel Driffin, who's a young man living with HIV, African-American man. And executive director of this task force was Melanie Thompson. And 5 subcommittees were created, very much similar to what San Francisco has done: a prevention and care, a social determinants of health, a data and evaluation of policy, and an executive committee. We have worked very hard on the task force. In December 1st, 2015, a year after it was created, we presented broad objectives. And by just a couple days ago, on HIV testing day, we presented more defined objectives and actions. We had a lot of community input, spent a lot of time in monthly meetings with the community, conference calls, face-to-face meetings, trying to really listening to what people were saying, looking at targeting populations, MSMs, young MSMs, transgender, et cetera. We also did a web-based survey to really try to get a lot of community input into ideas, prioritization, and we came up with a series of strategies. Number one is that we have to eliminate stigma associated with HIV. Sexual orientation, gender identity, expression. If we don't address stigma, it's a major driver of people not wanting to come to care, not wanting to be in care, dropping out of care, et cetera. Number 2, we need to eliminate barriers to care. I really like the presentation from Indiana saying we need a one-stop shop. Well, the reality is in many states, Republican states or right-wing states like mine or like Indiana, they have put a series of barriers for people to vote, which includes getting a state ID. And those have become barriers to getting into care. People cannot get into care if they don't have a state ID. If they don't have a state ID, well, in order to get a state ID or a driver's license, you have to have a birth certificate. Well, guess what? In order to get a birth certificate, you have to have a state ID in order to enter that building. So those barriers to care, those barriers to voting have actually become barriers to care. And what they did in Indiana of creating a one-stop shop where people can do this actually is something that we also need to do everywhere, not just in Austin County, Indiana. And we really have to change. I mean, there's so many barriers to care that those are the reasons why people are not linking well, they're dropping out of care. And I emphasize to people, if people drop out of care of a healthcare system that didn't work for them, if we try to re-engage them, they're going to drop out again. So we really need to address those issues. This is where we are right now. So here we are, linked to care, retaining care, virally suppressed. This is where we would like to be. This is where we are right now. We think that 76% of the population in Fulton County is linked to care. About 46% are retaining care, and of those and 42% are virologically suppressed. Now, we're doing a lot of things. One of the things we started already doing is linkage to care. The National HIV Strategy in the United States says we're going to link it to care within 1 month of diagnosis. We have dropped that to 72 hours. And so far, so good. We're actually being able to achieve it. We hope to continue doing that. We are implementing routine opt-out testing. This is including all healthcare settings and including jails. This is, as you recall, it was a CDC recommendation many, many years ago. It's one of the most ignored CDC recommendations ever made in the United States. Most healthcare facilities are not doing opt-out testing. We want to coordinate and monitor target testing with condom distribution. We want to create PrEP and PEP access. And our goal is to have 0 babies born with HIV, because the reality is we still have had babies born with HIV in Fulton County. We're addressing education, housing, mental health, and substance abuse issues. And again, we are, what's happening in Indiana, in Austin, Indiana is not, that's only in the canary in the coal mine. Many other communities in the United States are seeing an increase in opioid addiction and heroin. And I think we're going to see exactly the same outbreaks in other places if we don't implement now needle exchange, substance abuse, opioid substitution therapy. We need to look at healthcare policies. We have to address criminalization. That really is a major challenge. We need to get needle exchange, and we have to make sure that we close the insurance gap. In states that have not expanded Medicaid, this is a major problem. We're getting ready now, we're working now in what we call the phase 3 of the strategy. This is really developing accountability metrics, timeliness, and looking at where are the resource gaps. I think there's a lot of resources. We just don't have those resources adequately targeted and adequately put in place. Sometimes you find 3 people doing HIV testing in exactly the same site 3 days apart, and yet other communities where HIV testing is not happening. So I think a lot of data-driven budgeting is really what we need to do. And again, I'll end by saying that this is not a work of mine, this is a work of many people. I'm just part of the task force, but really Melanie Thompson has been the driver together with Wendy and Daniel Driffin. And please follow us. We still are hoping to do more, and this is only the beginning, but our goal is we're way behind San Francisco, way behind many other cities, but our hope is to also end AIDS in Fulton County. Thank you very much.